It's a beautiful day in the gayborhood, a beautiful day to ask a gay doc with Dr. Renzo Corzano or Desert Oasis Healthcare. Hey, Renzo, how's it going?
Going pretty good, John. How are you?
It's great because we have a special guest who is joining us. Please welcome to our flaming Zoom room the fabulous Tomi Clinton of the Transgender Health and Wellness Center. Hey, Tomi.
Thank you for having me.
It's good to know you over these many years here in Palm Springs. The Transgender Health and Wellness Center is growing and serving the population in a way that is just unbelievable. So good on you.
Thank you. It's a lot of hard work, but it helps a lot of people.
Before we get into the Ask a Gay Doc part, tell people what the Transgender Health and Wellness Center does.
Transgender Health and Wellness Center was founded in 2018. We started with $10,000 and a lot of stress, and now we just cleared a $3.5 million budget.
Yay!
And we are presently the largest employer of trans people in the world. I compete with another person for that position, but right now I'm number one.
Oh, wow.
And we provide social services for LGBT people. We have a rapid rehousing program for domestic violence, sexual assault individuals. We have a strong focus on LGBT because those individuals need extra resources. We help with legal documents. We help with food, pet food, hair removal. If you're hairy, we can take care of that too. We even do buttholes.
Okay.
So do all of it. And I just opened the Healing Rainbows. This is the first of its kind in Palm Springs. And now I'm being summoned to San Diego to open our second office.
Oh, that's fantastic. Well, this is Ask a
good.
Gay Doc, and Dr. Renzo Corzano of Desert Oasis Healthcare wants to know more about how to serve our trans community better.
So I think we should start with pronouns, Tomi.
That's a good one. Pronouns are about respect and respecting one another. If the person has issues with pronouns, they can always use their first name, their preferred name. I do that often with individuals so that if they're in the process of transitioning or they're non-binary, because I still mess up on the they and them.
Wait a minute, you mess up pronouns sometimes?
I do. I'm old. It was male and female when I was growing up. So now we have this non-binary thing that is really a big movement with the younger generation. And so us binary trans individuals, which are ones that live as a woman or live as a man, we're working on it just as much as everybody else.
Should I always open a discussion just by asking my trans patients, like if they're brand new to me, like what their pronouns would be, or kind of like what name they would like to use?
You should. We
Okay.
put in our facility, we put it in the alerts. So when it comes up, it has an alert. It says preferred name or
Got
some, things like that. You could do that as well, so that you're prepared for the situation. Usually, if you normalize it, like in your email, put your pronouns. You can
Okay.
do that as well, because then you normalize it where it's not something special for certain people. So it's really about respect. And a person comes to a doctor and they're already underneath trauma, they're already carrying luggage, and now they're being disrespected. So it's not any different than when we had the AIDS pandemic and the gays had to go through that.
Right.
And the way that
Right.
they were called names, if it wasn't for the lesbian nurses, that would have been a serious problem. And so
The enforcers.
it is. So, the older gay men need to realize that in history, they've faced the same persecution. And so they have an opportunity to not be like that.
You had an interesting take because we had our lunch this past weekend, and you were talking about the importance of hair removal. For people who are hairy, hair removal sounds like something that's superficial and kind of cosmetic, but it has a lot more importance in the trans community.
Yeah, it's just a fun joke. My legs, I named one Chewy and the other one Baka. And
Oh my
so,
God.
I've taken care of all that. So I'm from a Slavic background, so I had really thick facial hair and I could shred paper towels or toilet paper with my beard.
Wow.
Now I just shake a tweezer at it and it falls out. I don't care anymore. But, you know, it's really important. It not only builds self-esteem, it helps with their mental health. We have seen and noticed that people are able to get jobs easier.
Mm.
They're more presentable, and people are like, well, I don't want to have someone I'm gonna have to deal with a customer that's conservative. And we find that that actually is very effective. And overall, it just improves your quality of life and individuals, because you're able to live the way that you express yourself. When I had a beard, you know, I wasn't having the door open for me. Now I don't have a beard, and the men open the doors for me all the time. Of course, they're looking at my boobs too.
You
But,
are old
you
fashioned
know,
though. You want to be treated like a lady. I mean,
I am very old. I'm very old school and very country. I'm from Arkansas, and so, you know, it's one of those things. But it is really enforcing and affirming your ability to live in the world as you see yourself. And that's no different than the gay men wanting that are feminine, that are hairstylists, wanting that to be accepted around the masculine men that get everything. It's the same thing. And so we just need to understand that privilege and accepting one another and respecting one another is not a currency. It's free. And we should share that with one another.
I have another question, and I've always kind of wanted to ask a trans, patient actually. I know sometimes, if someone is, like trans man, they might still have their cervix. Um, so what is an okay way or an acceptable way to kind of talk about doing like a pap basically? You know what I mean? Because a lot of the times they can be very triggering, right?
It is. And so I actually was last year helping Planned Parenthood with their national policies. And we got to that, and we got away from calling it, and with Inland Empire Health Plan, we got away from calling it women's checkups to wellness checkups,
Okay.
because,
Okay.
men can have breasts too.
Exactly.
And,
Yes.
and
and
so,
breast cancer.
they can have
Yes.
breast, they can have chest cancer. And so we got away from the word of breast and said chest. And,
Okay.
and we did those things. Trans men actually have a higher rate of cervical cancer and can die from cancer because of their inability to find affirming doctors that are willing to do that service, that don't treat them differently. And so that's really sad that they cannot find access to healthcare without humiliation. Imagine a trans man. I know a trans man that has a ZZ Top beard. Imagine him having to go to the women's clinic to get it done.
Right.
You see,
Right.
it's just general, gynecology is just general. The doctors learn that, there's nothing
Right.
special about it. A vagina is a vagina, and it's the same. It's a really underserved need in the community, and getting the word out to trans men that there is affirming doctors that are able to do that. It can be quite difficult because trans men tend to blend in quicker, and so they
Mm,
tend to leave the tribe and go live a cisgender life,
Hmm.
and so they're harder to find sometimes, unless you know the connections to one another.
You, I consider to be one of my sisters, and cisgender is a term you just used. And for those who are not initiated, what does that mean? You hear it all the time. You may not know what it means.
Yeah, a lot of people think that's a negative word, or like you're using the N word, and it's not. It is, because if I say gay men, well, trans men can be gay men too. You
True.
can transition from female to male and still be a gay man. Your sexual orientation changes the definition of it, but doesn't your attraction doesn't. So me, I was a gay man before I transitioned, and now I live as a heterosexual female. And my partner's very conservative. We live a very male female role life, and that's what I like to do. So we use that word to understand that, if you're saying a trans person's a lesbian, well, you say lesbians, they're going to say, well, what do you mean? I don't understand. So if you say cisgender lesbian, oh, they were born a female, they live as a female, and they're a lesbian. So it's just a terminology to help them better understand the definitions of the two, because you have a trans lesbian and they may not want to be called that, you know. And so you just, it's able to help them a lot better, and it helps to when you're communicating with one another to understand, especially difficult situations or privileges or a lack of inequity or access to things. Gays and lesbians, cisgender gays and lesbians get a lot more access than trans people. So that's not saying anything bad. It's just meaning that we're defining how we communicate.
When you have privilege, speaking as the only cisgender white male here, you don't realize it a lot of the time. And so you shouldn't be blamed for having the privilege. You can learn how to recognize the fact that you walk through a lot of doors that are open for you. And then you realize maybe you should hold the door open for a lady.
Absolutely.
A very traditional lady from Arkansas, Tomi Clinton, Transgender Health and Wellness Center. How do people reach out to you?
They reach out to me. They can go online at www.trans.health.
You are old.
I am.
www.
At AOL. At AOL.com.
I'm pre-Google.
People can actually go to Google and type in Transgender Health and Wellness Center, and it will come up.
Yeah, we have multiple locations all through Southern California. It's pretty phenomenal, the integrated systems that we've created to meet the need.
I'm proud you're my friend.
Well, I'm proud to have you as my friend.
Oh, she went all Southern Belle on me.
I just wanted to say that I'm really, really thankful, Tomi, because I feel like through my medical journey and my professional career, I feel like it's very needed to have, just a trans person to talk to educate us providers, because a lot of the times it's really hard for us to actually learn all this stuff on our own. So I'm very, very thankful for that.
Asking someone that's not in the clinic room or is the best way, so we avoid medical voyeurism.
Yeah.
But I'm always there to help any doctor that wants to learn and ask questions. And as you know, I'm pretty direct and candid sometimes. So
I love that. I love that.
I do.
I'm known for it.
I know. That's why I love you. Tomi Clinton, the executive director of the Transgender Health and Wellness Center. And you can go to trans.health to find out more. If you have any questions about any of the shows that we do here on Ask a Gay Doc, you can send your questions to LGBTQ Health at mydohc.com, and you can actually ask medical questions. Dr. Renzo Corzano, thanks for the great questions.
Thank you, guys. I really appreciate this.
Thank you. You did a great job.
Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGAY channel so you won't miss anything going on in the gayborhood. And you can always listen live to KGAYPalmSprings.com.